Welcome back, everyone, from the coffee break. And it gives me great pleasure now to introduce the next two speakers to you. First, Professor Mykhailo Pustovoit. Martin, please, will you put him on the screen beside me? Ah, both of you are there. Good morning to both of you. It is very good to see you both, and thank you so much for being part of our symposium this morning and sharing your knowledge, your wisdom, your experience with us. We are very, very grateful, profoundly grateful to you for your presentation and for being with us this morning. So I'll just introduce both of you. So Professor Pustovoit is a psychoanalyst and head of the Department of Psychiatry, Narcology and Medical Psychology at Ukraine's National Medical University. And Associate Professor Kataryna Dzivak is a medical doctor, psychiatrist, and assists in the teaching in the Department of Psychiatry, Narcology and Medical Psychology at Ukraine's National Medical University. So you are colleagues together in work, and you are colleagues together in this presentation to us. And the title of your presentation is Clinical and Psychopathological Characteristics of Children and Adolescents of Internally Displaced Persons who suffered from the hostilities of war. We look forward to what you have to say to us. Thank you so much.
Thank you very much for this possibility to take the floor and to give the data of our research. Of course, the research is ongoing, and that will be based on the number of data that we have been processed. We use the term forced migration, which is used to depict the migration when a person feels it by their will, when they don't have this feeling of home, being in their home. It's a certain replacement when there is no comfort of their home in their heart. And a second migration is when a person is forced to be relocated. When we talk about the relocation or migration, there is certain consequence between the actual relocation to the further rehabilitation and coming back. We also can have the two aspects of internal and external relocation, and we can feel this feeling of losing of your home when you are in the space which was really close to you. It's your internal relocation when you're deprived of it. Then we have external relocation, physical one, when a person has to leave their home because they feel there is no more safe, it is no more safe for them. They are looking for the new home. They're trying to find a new safe place, and they try to adapt to this place. And only after that, there is the realization of the painful processes that they have undergone. The majority of people, they think that such relocation can divide their life on before and after, and that is true. But the sequence of events is also very important when we talk about this gap between past and future. So we have three main stages here. The stage of anticipation of the destructive events, survival, and adaptation. Anticipation stage consists of two sub-stages. It's about a period where it's not clear for them whether their home is safe and comfortable. So they are basically trying to understand whether they feel at home or not. The second stage, that's already the reaction when they lose this feeling of home. which appears during this anticipation. So this stage really has a great effect on the mental well-being that was caused by the stage of anticipation. During the destructive event stage, these fears, internal fears, are implemented. Also, here can be different violence, destruction of the previous sequence of things, our previous worldview, and the catastrophic situation appears. The most serious threats for life, they appear here during this stage. A person becomes a stranger being in their own land. During the favorable conditions, there is the stage of survival, where the hurdles are already over and another safety appears. With no physical attacks, people feel some stability, but still their future is indefinite. And again, they have to adapt, and it leads us to the stage of adaptation. It is everything about adaptation to the new place of living. People have to start from scratch to learn some new language or to change their attitudes toward the world around them. Special focus is been made on the attempts that are necessary to preserve their own individual self within new context. All the above mentioned is very good, illustrates another clinical case that Kataryna will read out. This clinical case, we have the citation here from the patient. Everything has changed after the war. I don't want to laugh anymore. I don't see the joy. I have grown up over this short period of time. Right now, I know who am I. All the data have been modified in order to stick to the ethical standards. And the events associated with the outbreak of the full-scale war in Ukraine affected the fate of the girl who, together with her mother and stepfather, lived in the occupation in Kharkiv region for months. The patient is 16-year-old. She finished 9th grade of the secondary school. She excelled in many subjects at school, but her final year was marked by the outbreak of the war. After finishing school, she entered college, where she receives a degree in the cookie studies. The girl's parents were not involved in her upbringing and her life in general. Her mom was alcohol addicted and often subjected her daughter to physical and mental abuse. She doesn't remember her own father. Her stepfather was also present in her life, a loafer, drug-addicted, impulsive, and unbalanced man. Talking about her mother, the girl remarks that they had not had a close relationship with her since early childhood. Her grandmother she stayed with turned out to be an aggressive woman, so her interaction with her was not normal either. When her mother visited her grandmother, the situation got only worse. According to her, her mother practiced physical abuse, and when her stepfather appeared in her life, the conflicts reached a new level and sometimes were accompanied by the use of knives, axes, and other dangerous objects. The girl was often not only a witness, but also in the center of the events. In her adolescence, which coincided with the war outbreak, conflicts with her mother got intensified, so she got under the care of social services and the Center for Psychological Protection of Children. The patient says that since the beginning of the full-scale invasion of Ukraine by the Russian army, she has experienced significant psychological changes, especially when the city she lived at that time, together with her family, got under the occupation of the Russian army.
Тоді ще разом з сім'єю, опинилася під окупацією російської армії. Отож, пряма мова пацієнтки. Перед початком широкомасштабного вторгнення у 2021 році, попри усе, мій світ був наповнений радістю. Зі мною люди бажали спілкуватися, в мене було багато друзів, які раділи моїй компанії. Однак, початок війни змусив мене постійно переїжджати, змінювати місце проживання. Це все ускладнило. Врешті-решт, через непримиренні труднощі з матір'ю, я опинилася в Центрі психологічного захисту дітей. Після завершення окупації мої погляди на життя зазнали радикальних змін. Я більше не прагну стати ні актрисою, ні співачкою. Радість життя втратила для мене свою привабливість. Життя моєї родини зазнало великих змін, коли ми переїхали в інше місто, що опинилося під окупацією російських військ протягом 1 місяця. Цей період мого життя виявився жахливим. Мої очі бачили, як російська армія відстрілювала молодих чоловіків в нашому місті, як вони вторгалися у наші домівки, забирали останні запаси їжі. На вулицях лежали мертві місцеві мешканці, з якими я раніше була знайома. Це були прості люди, що жили разом з нами в місті. Багатьох з них я знала особисто. Росіяни обходилися з нами дуже грубо, обзивали нас найгіршими словами, пророкували нашу загибель. Протягом того місяця нам не дозволяли виходити за межі нашого будинку, загрожуючи розстрілом за будь-якого
Most of the
порушення.
time we stayed in the basement of our house where we cooked food, although the Russian soldiers had already taken all our food supplies. A month later, the Ukrainian military forces arrived in our town and gave us assistance in leaving the occupied territory. After that, I ended up in a psychological protection center, and my mother was deprived of her parental rights. I try to forget the times of occupation, but the memories keep on coming back to my mind spontaneously, causing pain. Nightmares torment me as if I were back in the occupied city, witnessing various murders. These memories are merged with nightmares from my childhood when I watched my mother and stepmother using drugs, their conflicts and fights. In order to avoid unbearable memories, I try to avoid interacting with people around me and immerse myself into the world of gadgets. I always wear long bangs, which hide me, cover my eyes, and put a barrier between me and others. I usually don't want to share my feelings with anyone. During the period of occupation, I, previously unknown for myself before, experienced a remarkable maturation, an emotional touch of reality in all its harshness. My heart is now filled with anxiety about the future. It is especially fearful because I'm going to turn 18 soon and will have to start my own journey in my life. My soul is always dreaming of some peaceful and secure shelter where I will be able to live in solitude. Here, where I am now, everything is fine, but I'm aware of the temporariness of it. The next stage will come, the necessity to move to an unknown place. Where can I find the place where there is silence without shelling and without conflicts between the mother and stepfather? I dream of learning to be myself and to be alone with myself. According to the words of the caregivers of a teacher who's currently looking after me, I have a certain authority over the other girls. I can deliberately make them perform my household duties. I often find myself in a bed with other girls. This embarrasses me. But at this stage, I try to avoid complex issues. However, there will be a moment when I need to define myself. I feel the need for self-identification. I'm in a search of myself. I don't often know who am I. And then my existence becomes indefinite. I can't even clearly define my gender and understand who I am attracted to. Sometimes it seems I would rather be a man than a woman, because my ideas about men are filled with images of strength and power, and I want to determine my own life. That was the first time I had spoken to the patient, and many aspects of her life remain outside the narrative. Many of the events were too traumatic for her, and she clearly requested that we refrain from asking her about specific circumstances. However, despite all the difficulties, the conversation described above in general conveys the essence of a grief she experienced during the hostilities, the occupation, and the subsequent development of events. Our team continues to work with similar stories, but we have to admit that our resources are not enough to support all Ukrainian children affected by Russian aggression. We hope that eventually we will be able to create a comprehensive rehabilitation program for children and adolescents who have survived the horrors of war and to attract good specialists and funding from donors. We believe in the principle, only the one who walks will make it through. So this patient had different examinations according to the different questionnaires of NICHQ Vanderbilt as well, but again, we will continue with that. We have made scientific research on this in this case for such kids. These were kids that had direct experience of the military conflict in Ukraine. Some of them lost their homes and their close ones. Also, they were witnessing the murders. These kids right now in the territory of Western Ukraine, whether they are in different camps in Carpathians or some other centers in order to have rehabilitation there. As for now, we have processed the results of our research. We had 50 kids, 62% these are children aged 11, around 11 years old. In 16 children didn't have kids. Either they were deprived of parental rights, they had a certain neural disorders and general therapeutical one. I will not go into details. We have made detailed examinations according to the PCL5, which actually doubles the symptomatic profile of We also have made the scale according to the Vanderbilt in terms of the behavioral disorders. Everything has been completed within the ethical standards provided by Helsinki Declaration. Then we were using Microsoft Excel and other programs to have the diagrams. So we have done the screenings, and here we observed that only 18 kids were PTSD positive. Then we made more detailed scaling by means of the children's scale, and we have defined that 12 kids had the mild PTSD level. Also, 16 kids had mild level of PTSD. 13 and 8 people, they had the acute PTSD. Also, we had to watch at the symptomatic profile and to understand what that could mean. So basically, we used a PSL-5 scale and then Vanderbilt scale according to the B criteria, intrusion symptoms. We had a great symptomatic load, the feeling of being depressed or sad when they had the stress reminders, flashbacks. We had the C criteria. There were avoiding memories, thoughts of feeling related to stress. Again, they wanted to avoid the stressful experience. The D criteria, there were negative thoughts, negative beliefs about themselves. The biggest symptomatic load was about the negative feeling about themselves and about other people or the world around them. As for the E criteria, the symptomatic load was with irritable behavior or getting up at night. Then what we did was that we did factual analysis We have found that here we had two factors that have, you see that they are in red. So in red there is one factor, in blue there is another factor. I will read it.
So statistically, a program united a couple of symptoms into two main groups. According to the results of the factor analysis of the data from PCL5 analysis, one can make a conclusion that the first factor basically identifies primarily as the reaction of the psychics of a child to a complicated traumatic event of a war. That primarily has to do with the symptoms of intrusion, that feeling, that stress currently going on again and again. And those strong physical negative reactions and emotions while recalling those traumatic events, as well as the behavioral reactions of protection, meaning that this is as the symptoms of hyperactivity, to be on alarm all the time, and the constant will to do things that in the prospect can basically harm you. During this time, the second factor basically united and depicted more a depressive sign as a loss of interest to what was bringing pleasure before that, as well as the disorders of sleep, with the depressive post-traumatic state, with the problems with understanding and processing information. These are the complexities with basically focusing, the absence of the feelings of remoteness from other kids. And these symptoms very often remained unseen to other symptoms of intrusion and PTSD. The next poll and survey that we took a closer look at was the survey on the behavioral disorders of Vanderbilt. And here, the most symptomatic load had, in terms of first subscale of the deficit of attention, is the easy distractedness to everything what is going on around. Second subscale, that is a subscale of hyperactivity. The most symptomatic load here had anxiety, general absence of calmness, inability to sit on one place. So the third scale is the impulsiveness scale. According to this one, the most symptomatic load was the symptom of the absence of basically patience and given the answer before the question was finished. So in the subscale of the oppositional behavior, the most symptomatic load was on two questions: and willingness to listen and to obey to set rules, as well as the willingness to achieve what you want at any price, at any cost. It was very easy. That was very easily coming into aggression. In terms of the subscale of behavioral disorders, the most symptomatic load was the tendency to lie in order to avoid the punishment. In terms of the scales of depressiveness, the most symptomatic load had two symptoms. First is a fear of trying to do something new, and the fear, because of the fear that you will fail. And the second one is a complete inassurance in your own forces, in your own power. And the next and last scale was a social adaptation scale. The most symptomatic load here had those questions about the difficulties about following the guidances of adults. And what we did next, and here, by the way, one has to emphasize that these scales are not used separately to diagnose, but they are allowing to at least understand the initial problematic of behavioral disorders. Next, all these kind of numbers, and we were trying to go through factor analysis, and we saw three main factors present in this poll. And here one can see, and they are marked in different colors. And we will definitely publish this very article, and then one can concentrate more detail and take a look at it. I mean, let me tell our general conclusion about that. The results of the factor analysis of this very scale showed that there are too many indicators, as the problems with weight, with reading, with writing, the participation in group tasks, the ability to organize and understand the guidances of adults. They were united into one group, factor number one. We think that this factor is pointing out at the problems in different aspects of how a child understands and processes the information, its way of thinking, expressions, emotions, and orientation and navigation while talking to others. There is acceptance called hot, cold, and social cognitions. One can take a look at it as the means how a child reacts to complexities of adaptation to a hard situation and complex situation that the child is not capable of understanding by now. So there is a specific pattern of pushed identification of a child. Second factor united such indicators as a child react, rebellionship, the complicity of with the topics that require focus, as well as the conflict with those near and dear ones. In this way, we think that this factor has to do with the way how a child is coping with the surroundings and depicts the needs of the child and the needs in basically processing of traumatic events. So this is the way how a child is basically communicating his or her need in help. And the third factor united the signs of high activity, the tendency to do disobeying, such as stealing or something else. This might point as attempts to compensate the feeling of non-insurance in your powers. Perhaps one can understand here the following, that it does not influence the academical achievements and social success. To our mind, this factor is depicting a special disocial pattern of working through traumatic events that paradoxically can at first might seem as the most adaptive one. So all in all, the analysis of statistics and clinical analysis allows us to do the following conclusion, that war, this way or another, is a traumatical factor of traumatizing the psychological factor. On the other side, the belief of a child that his parents or her parents are the most powerful figures with the common borders create the necessary for the psychological survival illusion of being protected. And this is something that allows not to perceive the real danger or discomfort of internal displacement. If a child doesn't have this barrier of carriers, what is going on is a traumatization. In terms of hyperstimulation, there is basically fearing and scaring with unpleasant feelings. And these feelings might be mixed with the traumatical events in the childhood while causing the diffusional identity disorder that has been taught in the behavioral disorders. This way, children who went through direct or indirect trauma, they have different cognitive disorders. The most recent one and most often ones is the lack of attention, that to our mind is the inability of a children psychic to deal with intensive and non-understandable feelings, as well as the non-ability to find shelter from adult ones. Also, because of this, children themselves are not always capable, and due to the fact that they are not always capable and to recognize and articulate their emotional problems, and this always been depicted on that the answers of kids from this survey were more softer and lower than the answers of the carriers who are observing these very kids. What was interesting too is the fact that the most negatively children were marked with oppositional behavior, the ones that have tendency to individual conflicts with their carriers and the near and dear ones. Our interpretation was that this is precisely a group did not lose any hope and from empathetical adults who will help them to work through their emotional cutoff. Children who are losing their ability, and children are losing their ability to understand communication with adult ones, and very often they cause much less anxiety. That according to the principle of the wonder circle, is declining the distance between them and carriers. And children who are demonstrating active events with the elements of disocial behavior demonstrate less problems with the social adaptation and do not cause any kind of troubles from their carriers. And next, we remain the discussional questions, and we would like to raise them a little bit. Because the trauma of displacement is a multi-level trauma that touches the basis of the treatment of a kid to his life, her life, and to this world. When we're talking about kids, it is important to take into account the economical aspect of anxiety as a key element of a trauma, because we're talking about the psychic that is being formed right now. The intensity of anxiety is one of the indicators that separates traumatic one from usual pathogenic one. The idea of Freud about automatic anxiety comes quite at hand at this very moment, because a child is feeling the unknown threat whose nature is unknown to a child, and this can be described only due to economic terms. The protectional barrier is basically coming up on the surface, and this brings to disorganizations and the feeling of powerlessness. And this is called a pure trauma. Also, a trauma of displacement is a trauma that has to do with a good object and with a warm and comfortable settlement or powerful parents who can protect a child from catastrophic disorders. So in other words, to keep up the protective barriers. The loss of empathy and empathetical internal objects leads to inability to process a trauma, and this cuts off the ability of belonging to a group or to some kind of micro-social. Traumatical events cannot be processed without the presence of empathetical listener from both outside and inside one. That is why they can basically merge into stories that can receive some kind of validation later on. The problem of the trauma on displacement also is that a child cannot basically describe his or her traumatic experience into social narrative, because public is also looking at the displacement itself as something good, and in the majority, this public sets aside the displacement itself as a traumatic event. And for us to acknowledge this, not only the empathetic listener is needed, but also the general public narrative that will stop to arrange the events of war into real traumatic ones and the ones that one can consider as bearable ones, especially when it comes to children. These kids are the witnesses of a special story, but they do not understand what is completely going on with them. When they start to understand that, they have some kind of doubts, and they have doubts whether their thoughts have the rights to exist. If a society basically is disobeying and not following the reality, then these kids feel themselves put aside and left one-to-one with experience that basically rips them off from their internal security and makes them vulnerable to re-traumatization. And this statement and this narrative of scenes basically closes the doors for them, so to say, because they feel they will never be able to count for some kind of understanding from society. So a traumatized child is trying to domesticate its trauma and to make it softer while analyzing it on the example of non-acceptance that anticipates basically the attack of your perception system that has been shown in the symptoms of the deficit of attention, or so to say in the behavioral context in order to hoping to be heard that's been shown in the emotional conflict, or say in deviation behavior with the idea of basically pushing your will through to everyone. The tragedy is that until the trauma remains non-differentiated and the one from the outside, it will always be popping up unexpectedly and in the form of re-traumatization, repeating that will just prolong the internal bad condition of a child. Only the common recognition of a child in terms of displacement and a huge the huge will of carers and child will just allow to come closer to the medical memories of a child. In such a way, the distance to a trauma might be declining, as well as a chance to re-externalization of a trauma. And only after that, the child will stop to be the outsider in its own life. However, in terms of kids, this therapeutical process can have two dimensions. The understanding of what happened on one side can serve as a process of psychological integration and finding the sense of life, and on the other side, it can be a ruining process as well as a shocking one. That is why I think that it will not be over-exaggeration to say that a war as a catastrophic in all meanings event creates such a dense gamut of psychological fragments of human being pain that humanity hasn't created adequate technology of distillation of this substance in order to leave this dark side of human being in the past. Perhaps in order to design this technology, humanity needs some kind of distance to the experience of war and the distance in several generations of peaceful life that currently, unfortunately, doesn't look or doesn't seem as a reachable or feasible perspective. Thank you for your attention, and we are sorry that not all of the slides were translated, and this is because of we didn't have enough time, but we will definitely publish the results of this very survey with the article in English. And I will be happy if you happen to have any questions.
Thank you so very much for this excellent presentation. Your expertise, your professionalism, your understanding, your deep compassion for children all come through in the presentation that you've given us, and particularly how you defined the different levels of traumatic response, I thought was really helpful to us. And I was struck by the comments that you made at the end, and explaining to us why it is that trauma continues through the generations. We know this, that trauma continues through the generations. And I thought the explanation that you're giving us of that is so very powerful, that humanity needs distance from trauma, needs peace in order to be able to resolve the trauma that has happened. And that's not what you're living in within Ukraine at the moment, and it's not what we're living in within the world at the moment. So the trauma continues down the generations. Thank you so much, and thank you for the case study that you bravely presented to us, because that's a lot of information about a young woman, and thank you for sharing all of the details and the intimacy of her development and the things that have affected her in her life, her early difficult childhood experiences and abuse, and then the repeat during the time of war. So thank you for your courage in a way, and your openness in sharing her story with us. We have got a little bit of time, so as Mykhailo said, he would welcome some questions. Does anyone have any questions that they would like to ask? Alexander has a question. Thank you, Alexander.
Я так собі дві речі, які я одна рефлексія і
Yeah, two things away from me. One is a reflection, another one is a question. Because from one side, this very lady who said that now I am here, but I do not know what will be happening with me next. And this is something that it's not just one paragraph in her life. Something should be going next there. And this next is uncertain. And next one is that kids continue to grow up. And it is interesting for me how these very narratives of them, how these very stories of them change as long as on their path while they are becoming more and more adult. Because this very research is it's been there for several years, and this house that you take care of, these children are there all this time. And what is interesting for me is that the process of growing up, the war basically cannot stop it. Kids still grow up, and those girls who were girls in the past become women. Well, to answer this question, I would say that there are main tendencies as to me, and it seems to me. First tendency is the following: that sometimes the realization of what happened basically brings even more pain than it was before. In the state when the child, so to say, was basically dispersing its attention and was not trying to think about what happened. But that's exactly that very factor that speaks up for the fact that children need psychotherapeutical guidance, and so to say, with a very easy pedagogical or at least general medical or medical rehabilitation events. Well, this might not be enough. So that's the first conclusion that I have, as a tendency I have. The second tendency I have is in the appearing of a new peers that I recall. I recall that these are children who feel that growing up for them also means basically abandoning this new place that they look like they found, but a place where they found safety to this extent and their understanding. However, they have and they will have to abandon even this, because again, and this is something that will be done by force, because as soon as they are 18 years old, a state, so to say, will stop basically taking responsibility for them to some extent. And again, I think that at this very stage, they will definitely need psychotherapeutical guidance, because we all the psychotherapists know this unwritten rule when a human being not completely made put united the dots, a human being then will be afraid of its own future. And I think that it is timely here to recall the concept of Winnicott when he said that unrealized trauma of a past will definitely be projected into the future, and a human being will be afraid of his or her own future while seeing in the future the projection of their traumatical past. And here it's really important to have psychotherapeutical guidance. Thank you for the question. Yeah.
Yes, I've noticed that in the narrative of this young girl, she told that she has an enormous power over her peers,
Yes.
that they perform her wish. And so it's the same power that her mother had over her in her past. And it doesn't concern war. It's the repetition of trauma of her past childhood and the
Yes.
risk of her to become a tyrant.
Yes.
Так. Дякую за
Very good
питання.
insight.
Дякую дуже за питання. Ну, власне, я би...
Thank you very much for the question.
Тому що я би заповнив, я би сказав, що, власне, травма війни...
So I have a kind of objection or maybe addition and remark, because the war trauma, in terms of observing how the brutal force, can decide everything or the majority of everything, rather than a simple behavior, this backed up this feeling in her, the feeling of identification with her mother's behavior and his stepmother behavior. This is something that add fuel to the fact that by means of force, you can get everything. So that's non-adaptable way. I also think that what is the worst here is that not only that such a behavior transmits or continue the trauma living inside of her, representing or by the dissocial behavior, but that this dissocial behavior sometimes can let up new wars. And this is the way how war can have the two-folded phase. We can have the phase of the dissocial behavior of a traumatized child, and the barriers of this experience, they can cause another war when they become adults.
Thank you.
So it means that the war is ongoing.
Yes, the war is ongoing. Yes. Yes. Thank you. That's a very insightful answer also. So Oksana has raised her hand, and Martin, if you can allow her to speak now, she can give her question.
Hello, everyone. Thank you very much for the symposium and thank you for the speech. I would like to ask you whether those children who were interviewed, did they have previous traumatic experience with their parents, whether they have been deprived of parental care, or these are children who, before the full-fledged war, they lived in the normal, healthy environment? Because this reminds me, these behavioral expressions, they remind me for the behaviors typical for orphans or those who were deprived of parental care. So I think that these kids, they had probably the secondary trauma, and maybe their symptoms and something that they have been through is multiplied, right? It was kind of, they were re-traumatized actually. Thank you very much for the question. Yes, we had a group of mixed kids. I told it. 16 kids didn't have parents. Their parents were deprived of parental rights. Basically, state took care of them. They lived in orphanages. And some of children, these were children living in normal families. They lost connection with their parents, at least temporarily, maybe because of their, for example, father went to war, mom was wounded during occupation, for example. Yeah, so we had, again, the mixed cohort of children, and that was the first level of analysis. Of course, I agree that children who had certain experience before that in their early childhood, of course, they could have been re-traumatized, and they have this deviated behavior. But if you have a look at this trauma from the economical perspective, I would like to say that this war trauma is pretty extensive, so that the preliminary life experience, whether the person was really happy or miserable, this again is secondary, taking into account this perspective. So we talk about the mixed cohort and we analyze the general peculiarities for the kids.
Okay, and we perhaps have time for just one more question. So Anastasia, please, will you unmute and ask your question?
Thank you very much for this opportunity, for your presentation, for your research. What was interesting for me was the term of internal migration, and if it is possible, show us the perspectives as on the case of this girl, right? If this girl wants to be alone, Is this an attempt to find out this internal comfortable shelter inside, like a foundation for her? How do you think, is it possible for her? What do you think? It's a multi-layer question, I would say, pretty complex one. So I interpret her desire to be alone as a kind of distrust in the fact that she will find this shelter that could be reliable. And she can depersonalize this object, making the focus on the environment or space and not on a person. But generally, in its core, yeah, we talk about space or some protection. For her, a kind of, double or avatar of the absence of a good object. She cannot connect this because of her traumatized experience with the idea that there can be a person. Yes, there can be dependable, reliable person. She can feel herself consistency with, and she can be sure, trust this person. She can be sure that she can count on this person. Yeah, when talking about my expertise, I have to say that it's difficult to give some optimistic forecast in this case, but on the other hand, our life is so unpredictable, right? And if you remember, right, she had good cognitive skills. She was doing well at school, and right now she is going to have a degree. So probably with time, this experience will be rethought, and she will find herself at the place where she will work at work. She can create good working relationship with the team. And if these two levels will be undergone, then she can get into the personalized relations with some concrete person. So I would not lose hope and optimism. Otherwise, if our work couldn't change such difficult internal complications, there wouldn't be any reason of us doing our job, right?
Thank you so much for your answers to the questions and for this short discussion. And I'm reminded of the words of C.J. Jung when he said, as psychotherapists, we must understand the psychic situation of our time. And in order to understand our patients and our clients, we have to hold them within the context of what they're experiencing, because as you've described so beautifully, the trauma is sometimes external and sometimes internal, and reverberates kind of externally, internally over the course of a child's development and then as they reach adulthood. And you've illustrated that beautifully to us this morning, how we must all in this work hold that perception of we're always working within our psychic times and have to hold that in our minds. So I'd like to thank you so much for your presentation to us this morning. Thank you to Kataryna. Thank you to Mykhailo. And we look forward to you joining us in the round table this afternoon when we'll have some further questions and further discussion. But thank you very much for everything.